Well, welcome everyone. My name is Alastair Ager, and I'm delighted to welcome you to this webinar with that title, Informing Adaptation Strategy Through Mapping the Dynamics Linking Climate Change, Health and Other Human Systems. And it's a long title and it's a complex subject, but we hope to bring it to life for you in the next hour. I'm delighted to have such a strong range of panelists to address this topic from each of the countries cited on the left. I'm delighted to acknowledge the support of the Royal Society of Edinburgh with a small grant making this webinar possible, building on this network. And I'm particularly delighted to greet you from Scotland, the setting this week and next of the COP26 discussions. And it's we're very mindful of those discussions happening here alongside us, and we hope that the discussion that we have today will contribute to the recognition of the importance of two particular things I want to emphasize today. One is the importance of intersectoral and interdisciplinary collaboration. We have scientists, researchers from a whole range of different disciplines reflecting on this topic. And secondly, the importance of acknowledging adaptation. This COP26 is particularly marked by a real commitment to mitigation, to the reduction of carbon and the slowing of the warming of the planet. But it also is marked by a recognition of the climate change that's already baked in to the globe and the adaptation that's required for that. And this is meant to be an equally balanced COP26, looking at both of those issues, both crucially important, and we're firmly focused on the adaptation framing. It's my great pleasure to introduce colleague and friend Liz Grant, who is Chair in Global Health and Development, Assistant Principal Global Health, and Director of the Global Health Academy at the University of Edinburgh, just to begin our reflections. Over to you, Liz.
And thank you so much, Alastair, and welcome everybody today. And what I'd like to do as we have this conversation among all of us, so please do post in the chat, but it is to think about the results, this mapping exercise that has shown us that we can't just keep doing more of the same. We can't be putting a sticking plaster over broken parts. We need to be thinking very differently. It also asks us today, I think, to ask who's at the table, who is contributing into these conversations. And it is a time of, as Alastair said, unparalleled change in the world. And alongside this, the terrible global death toll of COVID pandemic, I think the pandemic showed us this very visible dismantling of industry, dismantling of our working systems. And the climate crisis as well is all about dismantling. It's dismantling the security that we had, the security of climate and the systems that underpin it. With the unexpected, the fearful dangers, weather events, our sense of norms has gone. And there's other dismantlings happening though. There's dismantling of social order, of education for all, of ethical decision making. There's dismantling of trust in the state of governing. And there's dismantling in governmental states and how they're functioning at the minute. And as we focus, especially in this week of COP and in this webinar, I think we want to try and make explicit that the crisis that we're talking about, the climate crisis, is not the problem, it's the outworking of the problems. It's the drivers of the crisis that we need to understand, and it's the adaptation strategies, as Alastair said, that we need to respond to. It's these interconnections of multiple crises. It's a syndemic. And all of what we describe at the minute can come under this umbrella of planetary health. And just for a moment, let me talk about planetary health before I hand over to Alastair and Giulia. But the planetary health brings together a whole set of thinking. It recognises that human life is much more prosperous than it ever was before, with the potential technological advances to improve every single capacity of life. That's where we're at actually in 2021. It recognises that the cost of these advances until very recently has been completely ignored or else covered up. The cost is deadly. The Lancet Commission on Planetary Health in 2015 said, we have mortgaged the health of future generations for the development gains of the present. But this past year has shown us it's not the health of future generations we have mortgaged, it's actually the health of the present generations as well. We are actively destroying the world that we're in. And there is massive inequality. The inequality and poverty go hand in hand, and we need to recognise those within this. So framed by the Anthropocene, this recognition that humans for the first time ever are shaping the geological age shape, this approach of planetary health not only sets out our human role in ecological degradation and the cycle of negative impacts, but it's also setting out the degradation on human health. But alongside that, planetary health is taking us to a different place. It's saying there's an inherent, there's a coherent, consistent rationale possible for cross-disciplinary decision-making on social, on ecological, on health, on environment, on economic issues that can bring about radical change. So planetary health asks us to think differently. It asks us to not work in silos, but in confluence, where different separate things come together to become one. It asks us to think not through separate lenses, but instead in consilience, where we link together different principles from different disciplines to form a comprehensive strategy. It asks us to approach challenges with an understanding that they're intricate, they're often invisibly interconnected, as well as the big visible connections. And it asks us to understand dependencies. Planetary health asks us to consider the consequences and the unintended consequences of actions taken and not taken. So to do this, we need to understand what's happening on the ground. And I'm delighted to hand over to my colleagues here, Alastair and Giulia. Thank you.
Thanks, Liz. And Giulia is going to just explain a little bit. We're delighted to launch this report today. On the left, it's been posted in the chat function. And Giulia is going to tell us a little bit about the approach to compiling it together. And then I'll take you through some of the main findings. Giulia.
Thanks, Alastair. Yes, hello, everyone. I will be briefly introducing the report that we're launching today. And as Alastair mentioned, I really invite you all to check the report, the link that you can find in the chat box. So briefly, the aim of this report or this research project was to map the complex dynamics that exist between climate change and population health across 4 settings that were linked to the research unit on health and situations of fragility. The aim was to make explicit the interrelationships that exist between the factors that shape climate change and health in each context, and identify the key entry points and pathways to develop targeted adaptation and resilience measures. So we did this by adopting, we conducted case studies with partners in Mozambique, Lebanon, Georgia, and Costa Rica. And to do this, we adopted a mixed method approach, which incorporated a literature review and system dynamics modeling. So for the literature review, we followed a standard literature review approach. We identified 40 papers, and we extract the information from these papers. On the other side, to conduct the system modeling, we collated the information that we identified with the literature review. And so we collated country-specific data using a causal loop seed model that you can see here on the screen. And this seed model identified the 3 core domains: the state of the earth system, the human-made influence and activities, and human health and well-being. So a preliminary causal loop diagram was elaborated for each country, linking the variables on the basis of the evidence provided by the literature. So these causal loop diagrams were then refined during online consultations with the collaborators in each setting. And we conducted the participatory workshops with health, climate, and environmental specialists. and where we confirm the key variables and also the core dynamics. And also during these consultations, we try to address the implications for national and local adaptation strategies. So I will stop here and give the floor to Alastair.
Thanks then, Giulia. And in elaborating the report, I want to give recognition of two factors. One is that we very shortly have experts from each of these four contexts who are going to speak on one aspect of adaptation strategy. And I don't want to spend too much time before I give you the privilege of listening to them. And the second thing is that in this approach of systems dynamics modeling, with the development of these causal loop diagrams that you see on the right-hand side of the picture, this complex spaghetti of interconnection, it really needs careful reflection. So I really encourage you to download the paper and to reflect on those dynamics over time and the reflections of the case studies. So I'm not seeking to summarize all of the complexity. If I have the next slide, please. This is a typical diagram. This is from Georgia, for example, and this is the causal loop diagram depicting, based on that seed model and then reflection over time, that the range of variables that came up in that literature review and then were discussed with colleagues in this multidisciplinary meeting, and the hypothesized and generally validated and supported linkages between them. And essentially on the left-hand side of this diagram, climate-related events, on the upper right, the health impacts of that, but then various other systems interacting with this. Now, this is a complex diagram to understand, and there's just two methods I'm going to try and use basically to try to clarify some of the key dynamics, and that's an animation linked to some addition or subtraction over time. So let me just take something out of that diagram for a moment. So here we have, clarifying the importance of air pollution and heat waves as a major source of population ill health, a concern of respiratory disease. And that was a major focus of discussion. And in the top right-hand corner, you see the relationship in terms of agriculture and then broader livelihoods in the bottom right-hand corner. So there's quite a lot of factors shaping population health linked to CO2 emissions on the left-hand side. But the huge space in the lower left-hand of the diagram, if I have the next slide, please, is all linked to issues around coastal erosion, extreme weather events, floods, etc. So we can see that not only was that part of the diagram missing, there was relevant dynamics, but there's interconnections then between the coastal degradation, the impacts on livelihoods, the impacts upon communities more generally in terms of water availability and health. And so just the key insight of this method is to, rather than to hide these complex interactions between different disciplinary approaches and different sectoral understandings, it's to try to draw out those connections and, acknowledging the complexity of them, identify key points of leverage where we might affect this system. And in red in this diagram and throughout the report, you'll see proposed actions in terms of adaptation that would redress some of the deleterious consequences of this system. The next slide, please. So if we go from Georgia to Mozambique, this is a partial diagram, particularly focusing on the impacts of sea level rise, the impacts of sea level rise on housing, particularly close to the coast in terms of the water affected there and the floods impacted. And again, we see complex dynamics, many points of potential interaction. But if we go to the next slide, we see there's a whole other set of dynamics that we consider in the group, which relates to conflict, relates to migrations of people and the fragility of the health system. So although we can simplify this diagram by just looking at one sector, we potentially miss important interactions with other areas that are potentially, in this instance, for example, migration, quite pivotal points in terms of people's access to health and the broader impacts of climate change. Can I have the next slide, please? So we're now, this is a quick visit, we're going to Lebanon, and here, let's initially focus on the dynamics of human displacement and population pressure, which are exacerbated by water shortages in the country. And Fady will talk a little bit about the broader consequences in Lebanon. And so we can see important dynamics here. We can see potential points of intervention marked there in red. But what this analysis, in a sense, is complete in itself. What it completely ignores is the role of the agricultural and broader systems. If we go to the next slide, that brings that in, which is not only filling that bottom left hand of the diagram, but is creating interconnections where clearly water resources and their availability are hugely implicated by developing agricultural practices. Population pressure is both exacerbated by and contributes to issues in the agricultural sector. So I'm just using this little device of subtraction to try to show the layering of the dynamics in these settings and the potential unique analysis that this form of analysis provides us. The final slide, please, for me. If we go to Costa Rica, then again, this is part of the diagram, particularly focusing on water quality, that the loops around water and sanitation, around disease vectors. And this is an appropriate and full analysis in terms of the health sector and in terms of the impact of climate. But it misses a really important area that Juan will be talking to us later, which is around economic activity and settlement. And when we add that dynamic in, if we go to the next slide, please, we see not only important areas of activity in the right-hand corner, but again, the crossovers of all of that work around settlement on marginal land, poorly planned settlements, and the broader impact of poverty and inequality on the whole system. So I've tried in just 5 minutes to overview very quickly 4 of the case study analyses, which bear closer reading in the report, and you tracing your finger around some of those loops and thinking through some of the consequences of trying to address and to adapt to or create resilient responses to those trends. But what we've done just at the close of the report is looking across these 4 case studies, try to identify some common broad patterns. And I just go to that here now. So pretty well in every setting, clearly we've got mean temperature rise leading to an increase in extreme events. And those extreme events, which are varied across these very 4 topographically and hydrologically different contexts, all represent some exposure of populations to risk, which leads to disease or potentially higher risk of disease and deleterious impacts on population health. So that's, for those of us who are health professionals, if you like, that's the core dynamic that we're seeing across these areas. And clearly many of us are talking about early warning or preparedness to be aware of those extreme events, aware of the consequences of those, such that we might reduce the population's exposure to risk and therefore reduce disease. So there is that important dynamic in all of the country case studies. The next slide, please. But we also see in nearly all of those the importance of agriculture and food. Unsurprisingly, is a key dynamic, not only linking to population health, but inextricably linked to those understandings of extreme events and their impact on agricultural production. And here, and Fady will be talking about this, the adaptation action, in addition to early warning, might be around adapted agricultural practice and land use, and is an important area. The next slide, please. So whilst those 2 dynamics are relevant in all cases, in pretty well all as well are these 2 other factors, that the health system itself and access to quality healthcare is clearly going to be a major mitigating factor in terms of broader population health. But many of the challenges of population health are actually making the adequacy and the coverage of the health system compromising that. And so important actions in terms of strengthening health systems resilience can improve access to healthcare and reduce impacts on population and health. But again, as Liz mentioned very strongly at the beginning, it's apparent across all case studies how livelihoods related to agricultural production, but more broadly, are hugely influential on population health, on access to healthcare, and more broadly in terms of wider livelihoods. And therefore, interventions and supporting the social security of particularly vulnerable populations is a key action highlighted across many of the case studies. And finally, I think a final step in this building up this picture, on the next slide, please, the value of settlement and the vulnerabilities of groups settled in low-lying areas or areas with poor sanitation or poor resilience in terms of extreme events is also an action replicated in many of the case studies. So whilst I think there's a real value in seeing each of these maps as an insight into the unique conditions in these situations, we've also tried to look across these settings to identify some recurrent dynamics, which encourage us to do two things, I think. One is to see that there are multiple points of leverage within these systems where that we could and should consider adaptation actions. But secondly, that these points of interjection in the system are not independent, but they're interdependent. And it means that our economic advisors, our city planners need to sit alongside our health planners and our climatologists and our early warning system folk to begin to plan in a coherent and truly multi-sectoral way. So that's a very, very brief overview of some of the core top-level findings of the paper. But really the core of today is just to give you the chance to hear from some of the actors who contribute to one element of that understanding in each of the countries. Obviously, we all have a home base in terms of our discipline, and I'm going to hand you over to Giulia to introduce you through our four guest speakers who are going to reflect a little on the contribution that they're making in their context to adaptation strategy. Thanks, Giulia.
Thanks, Alastair. So I would like to introduce the first speaker from Georgia, who is Dr. Mariam Maklekelidze. And Mariam serves as the head of the Department of the Institutional Cultural Development at the Tbilisi Medical Academy. She's an affiliate professor of planetary health and was previously the dean of the School of Medicine at this institution. She represents Georgia within the WHO initiative, Global Alliance Against Respiratory Diseases. And in 2020, Mariam co-founded Women Leaders for Planetary Health, for empowering women to lead planetary health solutions at the front lines of development in the Global South. So it is my pleasure to welcome Maka with us, who will be talking on the role of capacity development in the health sector for climate adaptation strategies in Georgia. So welcome with us, Maka, and the floor is yours. You're muted, Marta.
Dear Alastair, dear Giulia, many thanks, first of all, for inviting me to participate, firstly, during summer in the consultation process for drawing this report, and now inviting on this webinar to share some of the insights. I think you very well captured this complex dynamics of climate change related adaptation strategies in Georgia, especially if you take into consideration country like Georgia, which is a lower middle income country and where there are more gaps and challenges to be addressed than achievements to brag about. I think it was a very nice compilation. As you mentioned, right now I represent more academic setting, so my point of view will be shared from that perspective. My first, let's say, my contribution towards some of the inputs that were mentioned in this report was development of Heat Health Action Plan, which was done back in 2012 and 2013. Back then, I had the pleasure to cooperate with National Center for Disease Control and Public Health of Georgia and ICRC, and through a continuous consultation process, we elaborated a Heat Health Action Plan for Tbilisi, which was then coordinated by NCDC. This process was interesting because I myself saw, and all of us, because there wasn't that much big data in Georgia, although climate change related adverse effects are already seen from 60s, but there is no data, and there's especially very low health impact assessments of climate change impacts done in Georgia. And it was also interesting because I had an opportunity to work with healthcare sector to introduce this action plan and to emphasize why is it important and how it relates to the work they do, especially when you consider Georgia, where major burden of diseases up to 97% is non-communicable diseases, ischemic diseases, as well as chronic respiratory diseases. And also mortality and morbidity for this is around 20 and 25% accordingly. So there was something that we tried to emphasize and make these linkages, which also Althazar tried to draw in one of his last slides, that the prevalence of diseases is in fact very much related to this action plan, to the heat waves and to how to the climate change. But afterwards, I had an opportunity to go to Germany and work there in research, and I actually did a research on air pollution because I became very interested to see that. I saw that environmental effects were very dominant drivers of some of the non-communicable diseases and especially respiratory diseases. It is there back in 2017 when I first came across with the term of planetary health, and it was done through through one of the conferences within medical communities, Global Alliance Against Respiratory Diseases. There, one of the doctors from Spain introduced this term, and somehow I remember the statement that he said that we cannot live healthy lives on an unhealthy planet. So I got very inspired back then, and when I came back to my institute, which was a transdisciplinary institute, together with my colleagues, as Giulia mentioned, we formed these Women Leaders of Planetary Health. Afterwards, I came back to Georgia, and I took a position in academic setting, and there I thought that it was very right timing to promote this topic, planetary health, which is relatively new worldwide, but especially in Georgia. And in Georgia, even for climate change among healthcare professionals or even among students, there is much less awareness than in Western Europe, what I observed. So I thought that it's a very good ground to see if there was interest among medical students to introduce this topic. So in summer, we held a webinar, an international webinar, where we gave floor to students, and they prepared and did some research around different topics on health-related topics, and made these linkages with planetary health and drivers and risks of adverse planetary health. So I think that was one of the success, and that again demonstrated to me, and I think moreover to my colleagues, more conservatively thinking colleagues, that sometimes students are more agile and they have this pulse on the current developments, and they know because they had more awareness and they had more thirst of further knowledge and for further building these linkages between their peers all around the globe. Because obviously climate change is a problem of nowadays that affects present generations, but more importantly, it will affect future generations. So since then, within our setting, we formed a planetary health club, but that was also very interesting because we did a big survey among the students, what kind of topics they would like to pursue through their extracurricular activity, especially now when a bit the situation to COVID-related challenges more or less stabilized, and students can spend some time on campus. And the number one topic that popped up was this planetary health, ecological topic, together with mental health and the linkages between those two. So with this, I just wanted to say that there is a great need to promote these topics among future medical professionals, and especially coronavirus gave us a very great opportunity to see that evidence-based knowledge and understanding of of the state of the nature is directly related to our everyday lives and to our future well-being as well. So I think in that regard, we are aiming to introduce planetary health topics more intensively within the curriculum. But in parallel to that, I think what needs to be done on the country level is to educate health professionals again, because the awareness level is very low, and the linkages still, because they come from this post-Soviet legacy, different kind of type of education, and they're not so much, and plus we have many other social problems, and sometimes it's hard to understand for the doctors to see the linkages, how the social problems and climate change are connected. So there is one need, and from the state level level, which is also emphasized in our National Environmental Health Action Plan, is the need to build capacity already for monitoring systems to get better the monitoring of outdoor and especially indoor air quality, which is the very big problem in Georgia. And so the multi-sector is also very important. So I think that all of us, as my last word, because I think that we're very tight on time and I don't want to overcome, is that all of us can contribute with something. And given settings when there is this global problem like coronavirus, as if makes you forget everything, or you live in a very bad social conditions, still in any role that we have, especially I think health professionals and those working in academic institutions can do something. And these little steps and this interest that I see in students is already really giving me big hope. Thank you.
That's great to hear, Maka. Thanks so much, and for your encouraging work in creating these dialogues within health professionals in Georgia. That's encouraging to hear. Giulia, you're going to introduce our next speaker, I think.
Yeah, thanks, Maka. So our next speaker is Dr. Tatiana Marrufo, who is a medical doctor and master in public health. Tatiana collaborated with the first vulnerability and adaptation analysis of the health sector to climate change in Mozambique. And currently she's the head of the central office of the technical secretariat of the National Observatory of Health. And she's the coordinator of the observation platform for climate, environment and health at the Instituto Nacional de Saúde in Mozambique. So Tatiana, the floor is yours.
Thank you so much for having me here today. I would like to share with you all the strategies and opportunities to climate change adaptation in the health sector in Mozambique. Giulia, please, the slide. So it is well known that Mozambique is a country vulnerable to the adverse impacts of climate changes, and most of those impacts can be seen at the health sector, demanding more pressure and challenges to the sector. So in this, my first slide, I'm sharing one of the strategies, which is an analysis conducted for the first time in Mozambique. It was related to the vulnerability and adaptation of the health sector to the impacts of climate change. With this analysis, using the existing data from 1979 up to 2019, it was possible to triangulate the data and generate maps of exposure, sensitivity, and adaptive capacity, as you can see in the slide. So in terms of exposure, we rely on climatic variables and extreme weather events data. In terms of sensitivity, we rely on ecosystem, geography, demography, and population and vulnerable population also. In terms of adaptive capacity, we rely on data from human resources for health, budget for health, access to the health system, access to the wash conditions, and even the social determinants of health. As you can see in the first map that I'm presenting here, I'm showing that the one that is more in red, you can see that we are showing that around 90% of the districts of the country has a low to a very low adaptive capacity to the climate changes. So with these three parameters, exposure, adaptive capacity, and sensitivity, based on the guidelines of IPCC, we were able to calculate for each one of 161 districts of the country, the vulnerability index at national level. So with this analysis, we provided a list of recommendations for the health system as a whole, and even to orient a health national adaptation plan for climate change, the HNAP. Talking about the HNAP, I can move to my second slide. This is another strategy under development within the country, which will guide the sector for the next years in terms of adaptation to the climate changes at different levels. I'm talking about individual, community, public, and even private sector. Another strategy that is in place in the country is the efforts that the country are making in terms of generating evidence. For example, during emergencies and extreme weather events. As you can see in the paper that I'm showing here, it was published after the cyclone Idai, sharing our experience to control the cholera epidemic in Sofala province. So the country is using or could use this evidence to improve understanding of the process of adaptation and even at what level is needed for public health decision makers to act. On the other hand, the sector is finalizing a research agenda on climate, environment, and health with priority topics and needs for evidence generation. And finally, the sector is also working towards building a climate services for health. For example, being part of the National Forecast Cluster, in which different sectors are providing prognosis for the next rainy season according to the Met Office outlook. So I'm showing here a malaria risk map for the period of October to December 2021. This is our prognosis in terms of health observation. And these are the prognosis for the first period of the rainy season this year. Another activity or action is the early warning system. So we are currently developing an early warning system for climate sensitive diseases. I can show you in this chart, you can see alarm signals in dots, in the blue dots, which are signing the risk of outbreaks according to the epidemiologic weeks. So these could serve us as a preparedness strategy for future emergencies, using, of course, a multi-sectoral collaboration approach. So in the country, we learned that apart from the partnerships that we have established in the country and the advocacy for the adaptation to the climate changes at the health sector, to have funds to better cope with the climate and health risks, including the adaptation measures, it is essential. And none of these strategies in place in the country wouldn't be possible without those actions or without this partnership, advocacy, and funds. And I'd like here the financing and the technical support that we are benefiting in terms of climate and health in the country. And facing a vulnerability, it is also important to chase valuable opportunities to improve knowledge, to generate human capital and even infrastructures that are prone to enable resilient systems. And we also learned that building capacity for climate resilient health system, it is crucial to preserve the holistic approach of health so that we can better integrate the frameworks that can benefit the health system as a whole. So I must stop here, and I would like to thank the opportunity to share the Mozambique experience of the health sector in this regard, and thank you so much for having me today. Thank you.
Thank you so much, Tatiana, yourself, for such strong analytical work, and it's such an encouragement, I think, to see that sort of strong thinking into informing adaptation actions. I'm sure there'll be some questions on that, Tatiana, shortly. Giulia, back to you and our third speaker.
Thanks, Tatiana. Our third speaker is Dr. Fady Asmar, an expert in Mediterranean forest ecosystems. Fady has extensive experience in management of arid and semi-arid ecosystems, including ecosystem and forest landscape restoration, sustainable land management, climate change mitigation and adaptation, and empowerment of local communities. He collaborates with the public sector, civil society, and international organizations, mainly the Food and Agriculture Organizations, the UN Conventions to Combat Desertification, UN Environmental Programme, the European Union, and others. He's also a lecturer in several universities in Lebanon. So welcome with us, Fady, and the floor is yours.
Thank you. Hello, everybody. I'll try to stick to the 5 minutes allocated. Well, as the slide that Alastair has shown earlier, we have the relationship between climate change and health in Lebanon is particularly impressive, especially in light of the very severe economical crisis that we're going through with a huge, enormous depreciation in the Lebanese pound and the increasing number of population, the heavy weight of the migrating, migrants from neighboring countries and so on. So the challenges are very, very important and very difficult to manage, especially that in light of all the problems we're living, climate change is not at the front line of concern of the problems and the solutions to be found. Now, in the first place, let's look at the current situation of the natural resources. I mean, the natural ecosystems. Currently, the forest cover in Lebanon is at its highest since the beginning of the last century. So we're almost around 25% of forest cover between forest and the so-called other wooded lands. And then we have the rangelands and we have the agricultural lands and so on. So the green cover of the country is quite important. However, despite this high surface coverage, we are at the highest level of threats, with an increasing number of forest fires, and almost unmanageable forest fires, increasing number of insects, pests, and diseases, whether it is in the forest ecosystems or in agricultural ecosystems. It's becoming more, agriculture is becoming more and more difficult to manage in light of the need to import all kinds of inputs for agricultural production. So the whole setting is in place for a change, a paradigm change in agricultural practices and in landscape management. If we look at the needs and the challenges, on one hand, we need to conserve nature and forest and have a sustainable management of forest ecosystems and range ecosystems. And on the other hand, we need to feed the population and we need to provide some food security to the whole population and to cover the difficulty to import food and primary matter or whatever. So the challenges are very big. Adding to that, the climate change is causing a reduction in the rainfall and the reduction of the water availability and accessibility. So climate change is exacerbating forest fires with a longer season of fires and more intensive fire because of the higher temperatures. And then the water problem is being exacerbated with lower rainfall seasons. And when it rains, frequently we have, the Mediterranean very heavy rains and the flooding the consequential floodings that occur. So all these challenges lead us to rethink the agricultural practices, the production system. So I think we should be reverting back to the small ruminants rather than the cattle, rather than cows, dairy cows and cattle, which are quite demanding in water, in feed that have to be imported. And then that goes methane, and then that contribute to climate change anyway. And shifting back to goats and sheep, which are more adapted to the natural ecosystems, which require less maintenance if left in free range, etc. So this is on one hand. On the other hand, we should be looking again at reforestation practices. Why do we need to grow forests, and what kind of forest do we need to grow? The alternative would be to improve the forest ecosystems, to plant new forests, but wood production has never been a major element in the Mediterranean forest. So why don't we look at food forests? Why don't we grow trees that produce food, or that forest ecosystems that would help the production of wild edibles? So this is another important element. Going into agriculture and food production, why don't we shift back or go back to traditional products, homemade products that can provide food security to a large number of people and that are cheaper to produce than importing. All of these are elements of a puzzle of the traditional old-fashioned management of the landscape, which is the agro-silvo-pastoral system, which is a mosaic of uses of the landscape between agriculture, forestry, and rangeland. All of these can, in the Mediterranean region specifically, with the limited space that we have, all of these could occur on the same land. In other parts of the world, we may have forests for wood production and rain and lands for agriculture, etc. In our challenging conditions, we should be looking at this mosaic of landscape where we would have a mixture of the agriculture, silviculture, and pastoralism under one ecosystem. So our forest management would, while conserving the forest resources through some traditional management practices, allow for under-forest grazing, allow for the production of food, agricultural production in some cases can occur under the trees. And this would be an adaptation practice that would allow for the conservation of the natural resources, the provision of food security, and most of all, improving the landscape, looking at the forest and landscape restoration. The restoration of this landscape would be putting back the human being at the center of interest. So our forest would be mainly for the production, for the food security and for the food life quality, livelihood improvement of the local communities. So this pastoral system would help us improve climate change adaptation and provide food security and better health. Thank you.
Thank you so much, Fady, for now and previously articulating so clearly the role of exploration of that agricultural land use system and its close implication with water sources, with human health, climate change, economic systems. It's been a privilege to have you engaged in this project.
Thank you.
To our last speaker then, I think, Giulia, before we go to Q&A.
Yes, our last speaker is Dr. Juan Robalino, who is currently the director of the Institute of Economic Research and an associate professor at the Department of Economics at the University of Costa Rica. He's also a senior research fellow at the Environment for Development Initiative. He was the director of the Latin American and Caribbean Environmental Economics Program. His field of specialization span from environmental economics, applied microeconomics, and development economics. Welcome with us, Juan, and you have the floor.
Thank you very much. First of all, I would like to thank the organizers for the invitation. It's an honor to be invited and share this panel with all of you. I'm going to speak about some of the effects of climate on socioeconomic outcomes and about the effectiveness of adaptation policies. But before that, I would like to clarify 2 points about estimating these effects. First, I will have to say that our main concern basically in our region is changes in precipitation, and mainly changes in the likelihood of extreme precipitation events. In Costa Rica and in general in Central America, we're facing both increases in the likelihood of droughts in some areas and the intensification of precipitation in others. This certainly disturbs economic decisions and outcomes in very different ways. Second, from the research perspective side, separating the effects of long-term trends of climate from the effects of normal weather variability, it's a very difficult task. You need very long periods of climate data as well as of socioeconomic data. This is not always the case in developing countries. Additionally, even if you have this long-term data, you would end up comparing socioeconomic outcomes between 2 very different time periods, which might not be adequate. So we as researchers end up measuring mainly the effects of weather variability. in economic outcomes. This is a bit different from long-term trends, but luckily, given our concerns about extreme events, this might give us important insights about what will happen when they become more common, as it's projected. However, there will still be a lot of relevant research questions that we can just partially answer. So what do we know in our region? Well, some of the issues that Alastair already discussed, we are concerned about vectoral diseases. There is also evidence that weather variability might affect birth weight. For example, there's evidence in Peru and hospitalizations due to respiratory conditions in Brazil. But there is also evidence that excess of precipitation might affect children's growth. However, climate might also affect other decisions that might affect health in different ways. For instance, there is evidence in Costa Rica that excess of precipitation affects schooling dropout rates. And we do find that these effects are stronger in poor areas and where schools have a worse infrastructure. Also, meteorological disasters affect immigration decisions, something that developed countries might really care about. And measuring these effects is not so easy because they sometimes have even opposing signs. If hydrological disasters are mild, they increase migration, for example, and if communities are hit very hard by an extreme event, the migration decreases. Education and migration are two socioeconomic variables that show that current weather and events will affect socioeconomic outcomes in the long run, and of course, part of that are health outcomes. So what can we do to address this problem? The number of adaptation strategies discussed by policymakers is super large, from improving physical infrastructure to using nature-based adaptation strategies. However, which adaptation strategies work better is still a question that needs to be explored and answered. Nature-based strategies might be, for example, excellent because they protect forests, they help to mitigate climate change, but they can also regulate the flow of water, and in the case of increasing precipitation, extreme events, they might be very effective reducing natural disasters. That's what we find, for instance, in a paper where we look at the effects of protected areas in natural disasters in Costa Rica. So land conservation policies might be an excellent tool for mitigation and adaptation. However, we need to be very smart about targeting. What does that mean? Well, we need to select the areas of forests that really generate these ecosystem services. Not all forest protection will generate the same amount of ecosystem services, and not all forests is threatened equally. Additionally, we do not have infinite amount of resources, so we have to be smart about how we, with our limited budgets, can generate the largest amount of services. So,
thanks ever so much, Juan. I want to try and I do want to leave a bit of time for Q&A right at the end, and okay. I really appreciate, Juan. I think that what works for who and what works best is such an important question to be framing. We can perhaps have some Q&A in the chat, but I wanted to just flag two questions that have come up earlier. And I also wanted to welcome or signal with us Dr. Jessie de Maria Kinney. And Jessie is Deputy Director with Plan Adapt, but crucially at the moment is Head of the Secretariat for the Adaptation Research Alliance. And really great to have you joining us at the last minute, Jessie. I really appreciate this. I'm not going to put you on the spot just this minute. I'll go to a couple of questions, but I really wanted to give you the last word because I think it's one of the things we've sought to do in this project is to identify the research needs and the importance of locality of research. And just as Juan is hinting at there, the detailed research to look at what works when, in what circumstances, and there's some generalized we can share, but a lot of this is around sponsoring and fostering really high quality research to inform adaptation research decisions. So thanks ever so much, Juan. Sorry to cut you off. Jesse, I'll come to you in just a minute. I'm just aware we've got 5 minutes of time. Giulia, there were a couple of questions, one from Loffreda, which I just want to flag, and maybe one of our guests would like to address it. It was talking about the impact of migration on health outcomes, and actually was migration inevitably a negative consequence in terms of potentially improving health outcomes? And just from observing across the case studies, Valerie, what I would say is that in terms of the causal loop modeling through other influences, of course, migration could have potentially positive impacts to bring populations close to high quality services. But in most of the contexts we were studying, migration was leading to settlement in poor environments with poor access to health services. So migration was leading to poor health outcomes through that route. And in some contexts, Lebanon and Mozambique, migration was also involving an outward migration of health workers. And as environments become more inhospitable, then many health workers are using the currency of global employment to actually then denude potentially the health system of capacity. So those were two dynamics that were both negative. I don't know if Juan or Maka or Fady or Tatiana, anyone would like to otherwise comment on migration as a factor in terms of broader outcomes.
Okay, maybe.
Yes, you go, Juan.
I think migration is also an autonomous adaptation strategy, right? So it might have both effects, right? It might improve health of what will have happened if without the migration, right? So I think it's important to consider that part too.
Thanks ever so much, Juan. Acutely aware of time, Jesse. I want to come to you just for two things, I think. One is just a general reflection of the state of adaptation research globally and what your hopes are through the Adaptation Research Alliance. And there's actually a question from Jenna Rhodes, which is relevant to this, and it's about the relevance of health arguments regarding climate change against broader economic or environmental ones. And so where's the place of health? We're clearly trying to model a multi-sectoral engagement, but what you saw as the particular piece of health in this broader picture on adaptation research. So over to you, Jesse.
Great. Thank you very much, Alastair, and thanks everyone. Also, congratulations, of course, to the authors for this really great study. I think a lot of it really resonates with what we are doing in the Adaptation Research Alliance. I mean, I've heard a lot of things, what works for who, what works best, the idea of systems thinking, kind of this cross-sectoral, intersectoral lens. I mean, I think a lot of these issues are exactly what we're grappling with and what needs to be addressed now. I think for the sake of time, I will speed ahead and kind of spare you the information on the Adaptation Research Alliance. But please, you're invited to visit our website, check out the Alliance, do get in touch with us if you do have any questions. But for this conversation, what I'd really like to do is to highlight one of our work streams, which is a consultative process. And in the consultative processes work stream, we aim to identify research needs and opportunities. And this is identifying critical knowledge needs and actions and options for action research and innovations within adaptation solutions to actually meet those needs. These needs, of course, are kind of user-centered, very, very bottom-up driven. And we currently have 4 consultative processes, one on global health, looking at climate resilient health systems, another on climate risk assessments with a focus on LDCs, a third on gender and social inclusion, and the fourth on food systems with a focus on agriculture. So just today, we've actually finalized this global health process, which was led by the Red Cross and Climate Center and UK Health Security Agency. And one of the people is actually in the audience, which is Tilly. So thank you, Tilly, and the delivery lead team for a really great job on this. And the process really parted from the idea that there's a need to demystify the health system complexity through better mapping of interdependencies and within the building blocks of the health system itself, alongside other sectors it depends on for its functions from a climate change perspective. So I identified various areas which have just come out now, but generally speaking, and I'm sure these were also discussed here today, I was only able to join the second half, but issues such as leadership and governance, the workforce, information systems, infrastructure, service delivery, among other areas. But I think what was so interesting about what we found from this particular topic area, as we call them, was when we actually looked at this topic area, plus the other finalized topic area of climate risk assessments and LDCs, and the other two preliminary, let's say, stages where we're at, we recognize that many of these issues we're dealing with are not sector specific when you look at what are the challenges to adaptation. And therefore, we should be considering adjusting, this next, let's say, initiative of consultative processes, or potentially even some of these larger action research programs, to really kind of enable this cross-sectoral approach. So while the chair's summaries across these 4 topic areas were naturally specific to sectors or regions, the consultative process really highlighted that these issues are actually more universal than anticipated. And although we had a very short time frame, there was, it was a rather complicated process over the summer as well. There's a really wide set of recommendations that came out. So this report will be made public soon, posted on the website, ARA website, very shortly. But really, I think one of the main issues that came out here, in terms of this action-oriented research that the ARA really wants to promote and work towards this paradigm shift in the way research is done, is the need to work with the communities and the vulnerable group to actually identify these priorities. And then once those priorities are identified, is actually really to take a systems approach. And from what I can see and what I've heard, this was actually taken into the research here, which I think is really excellent. There was actually one other point that I wanted to raise here, which it just slipped my mind. But yeah, I hope, Alastair, that helps to answer some of the questions. Yeah.
That's great, Jesse, and thank you so much for joining us late in the day as a discussion. We need to wrap up now. Julie, if you just take us on to that concluding slide, just in terms of the report. It's just interesting, some of the recommendations of that report very much resound with what you've just been saying, Jesse. And we just think that convening local actors is such an important thing. At one level, these are 4 independent case studies, and I think we hugely recognize that very, very different situations. So recommendation A is all about just enabling those local national conversations to identify potential sources of action, just as Juan was talking about evaluating what of a number of adaptation actions. But I'm nonetheless, as a scientist, interested in learning across settings and some principles, and so some other thoughts there in those final recommendations about learning, and particularly, as just to pick on one of them, in terms of number C, which is what Liz flagged right at the beginning, just the awareness of the economic vulnerability of certain populations, and the importance of economic measures and inclusion measures to support populations facing the harsh realities of climate change. Thank you so much, Jesse, for joining us. Thank you for all our speakers for not only joining us, but for contributing to the dialogue. Thanks, Liz, for sharing in terms of developing this project, and Giulia for so much hard work on it. Thanks to the Royal Society of Edinburgh for enabling it to happen, and delighted to do this in COP26 week here in Scotland, and we hope and we pray for very positive outcomes of that. Delighted, Jesse, that ARA is being formally launched during this period, and we do anticipate adaptation research being at the core of this agenda for a number of years to come. Thank you all. This will be recorded and shared, and please download the report, which will be on the website if you haven't managed to get it from the link. And we appreciate your attention and your interest in this matter. Thank you all so much.
Thank you.
Thanks, Julie, for all your work.
Thanks, Alastair.
Indeed, Giulia, that was excellent. And to all the speakers, really appreciated that.
It gave some real flavour, didn't it, from the different contexts. So, and thanks so much. I don't know if you're still there, Jesse, but thank you so much for joining late in the day. It's just great to connect with the ARA. I always call it ARA, but is it the acronym now?